So in chip accessories, another group of very important and very familiar hardwares are microcatheters. So they are, we know they are minimally invasive tools, which is now becoming an integral part of PCI because we are now moving on to complex PCI more and more. So practically, this is one tube that should resist kinking with reference to the structure. The design characteristic, it should have pushability. So that will depend on the axial stiffness of the catheter. Torqueability, it will depend on the torsional stiffness of the catheter, and trackability depends on the flexibility. So all these features are taken care of during manufacture, and accordingly we select according to the lesion characteristics as well. So basic feature functions, we all know it supports guide wire. It helps in guide wiring in complex lesions. We can actually, after advancing, we can take the wire out, reshape, and give additional bend to the tip and do all the tricks there. It can facilitate and upgrade it. We can upgrade a guide wire in cases with CTO, and protect proximal vessel with wire injury. We can, after crossing the difficult lesion, we can make sure by injecting through the microcatheter, and in rare case of catheter or wire-induced perforation, we can use these pods as a delivery for coils or fat. So this is one case where a right coronary artery long CTO, there is diffuse calcific segment in the mid and right coronary artery, so I could not advance the this is a fine cross microcatheter. From that point, it could not be advanced, so I had to heavily depend on the wire escalation. So this, all the traditional wire failed here. You can see it is going subintimal. This is a Conquest Pro 12. So finally, I was about to give up, and I did all the wire exchanges. So this is the, we took a wire which was on shelf, which is used actually for a peripheral CTO, so Astato XS20, and I was lucky I just could pierce the cap, and then after injection and after rotablation got a good result. In this is another case, CTO, retrograde approach. You can see through the Corsair, I could inject and see and define the lesion bend, and I could shape actually the Conquest Pro wire to retrogradely pierce the distal cap, which was tough, and entered the lumen without much difficulty here. And this is retrograde with subintimal tracking. Here it took some time to pierce. This is again a Corsair which I took for support, and I could actually advance the wire. This is a Conquest Pro 12 to pierce the distal cap, and it entered the subintimal space, and then you can see I could track this Corsair comfortably through the subintimal, and then completed by reverse cart technique. So we broadly group them into single lumen and double lumen microcatheters. In dual lumen are now increasingly becoming popular because of the complexity of that cases that we now do. Another way of grouping it is big microcatheters, small, then angulated tip or deflectable, and dual lumen microcatheters, and catheters which has plaque modification characteristics. So we all know about these small caravel, fine cross, turnpike, and microcross. They are very commonly used. Corsair are slightly higher profile, turnpike, and Enhancer Pro and Mizuki. Angulated includes Supercross, Venture, and Swift Ninja. The dual lumen is Twin Pass, Sasuke, and other. And plaque modification is Turnpike Gold and Taurus. And there are many other products which is in the pipeline. The single lumen microcatheter, it enables the placement of wire. We can reshape and do wire exchange, as we say. So it is actually preferred over the wire balloons because we have an accurate visualization of their tip profile, so we precisely know the location of the catheter. So these are the overview of catheters. So fine cross has a very low profile, crossing profile of 1.8. The advancement is actually by forward push. It's not a good catheter to rotate and advance. Corsair and Corsair Pro, it has slightly larger profile, but it is advanced in clockwise rotation. So in that way, it is very helpful in advancing in tortuous lesions and retrograde CTO recanalizations. And Caravel again is a very low profile from Asahi. Again, it is for forward push. In dual lumen catheters are twin pass and fine duo and Sasuke. Here there are two lumens here, nearly 7 millimeter proximal away from the distal tip. You have another exit of lumen where you can actually take the second wire and do cases in selected cases of CTOs and bifurcations. So these are the big catheters, Corsair Pro, Turnpike, Mamba and Teleport. You can see it is structured, designed in such a way that it is braided for the tensile strength. It is a dual layer bidirectional coil which is actually helping in kink resistance and the torque that we need in certain complex cases. Small microcatheters are Caravel, Fine Cross and Turnpike. So most of them have similar, more or less similar characteristics and hydrophilic coating and distal tapered structure. And deflectable angulated are very useful in certain angulated lesions, and it actually helps selective wiring in situations like these. Dual lumen catheters have two lumens to facilitate precise and independent handling of two different wires. So one lumen contains a rapid delivery system, then the other lumen is an OTW where you can advance the wire. Twin pass are Sasuke and Crusade are the main wire, the DLMs that are available in our market. And they are specifically indicated in bifurcations where there is a higher angulated. You can do a reverse wiring technique to cannulate the side branches with a very unfavorable takeoff, and you can rewire side branch through the stent stud as well. In CTOs, it can be used for parallel wire techniques, and a combination of bifurcation and CTO many a time we come across, so it can be used for side branch anchor and wiring and other indications. So, so as I said, it is predominantly indicated in CTO PCI and in non-CTO PCI in bifurcation lesions. This is another side port, this dual lumen catheter that is recross, which is 8 millimeter tip to the second wire exit. Microcatheters with plaque modification include a Turnpike rod, which is a gold-plated threaded structure, so which can be used advanced through the difficult plaque, so it can help in plaque modification as well. These catheters are usually, when handled with care, they are usually safe. Complications are less, but once in a while you can have a tip fracture or a deformation or entrapment. And you should be very careful when you reuse these catheters, and you have to inspect them very thoroughly. And finally, an algorithm how to select. So in a lesion which is not a chronic total occlusion, so if it is proximal tortuosity that we need to come across, so a fine cross, a Caravel, a small profile, that would be enough. And if there is a side branch access and bifurcation lesion, as we selected, the dual lumens are increasingly becoming popular. Wire extension during the rotablation, again, fine cross and Caravel would be enough. And distal vessel perforation management, fine cross or a large bore the catheter. In case of CTO, if it's a recent occlusion, what we need is a wire support and a wire exchange. So a fine cross and Caravel will do the job. In chronic total occlusion, if you have going retrograde through septal collaterals, Caravel, or if it is a straight septal, Corsair, which is very workhorse microcatheter. And but if the balloon is uncrossable, you can go to heavier microcatheters, and for parallel wiring, it is very useful to use double lumen catheters. Thank you so much.
Thank you, Dr. Shafeeq. Again, we have once we have more into complex CTOs, there are very newer, day by day you have newer techniques coming. I think the Asahi has a big portfolio of these devices, and the fashion is latest is dual lumen. Any personal experience on use of dual lumen?
I have limited experience in dual lumen. So for me, workhorse catheter for all those complex lesions other than CTOs is fine cross, where I depend a lot on pushability and exchange of wire. And in CTOs, I use Corsair. Dual lumen experience is limited.
Comprehensive talk.
I would like to hear from experts here. Sorry.
Do you encounter situations where you have to use an over-the-wire balloon in spite of having so many microcatheters?
No, we hardly use over-the-wire.
See, upfront dual lumen catheter usage is usually in a proximal cap puncture, ambiguous cap puncture, where we can use an upfront dual lumen because that gives immense support to your antegrade wire. Often we use even Harnett or Conquest, 10, 12. So when you use such wires, you need a very stable catheter there. Otherwise, you keep, dissecting the vessels where your IOS catheter is. So that's where we use. And next is side branch wiring in CTO. And also in a retrograde, Sasuke is compatible. It's a small profile. Crusade is not compatible. Size is a bit big, going retrograde is difficult, but Sasuke can be used even in retrograde through the septal collateral.
Especially when the collateral is at the exit port of the lesion and you have that ankle, so
and
you
also,
can use the second lumen.
Sometimes your RCA will be more coaxial with PLVB than PDA. So your retrograde goes into PDA. Since PDA is more aligned with PLVB, just wire goes into PLVB. It's very tough to turn wire into the proximal. That's where you can take a retrograde Sasuke, and then you can direct your wire. So, and also other is you already mentioned, abnormal angulations, where if you want to wire reverse loop technique. For reverse loop technique, you need a double lumen.
They're slightly larger, so it's better to take a guide catheter of 7. It is 6 French compatible, but it will be comfortable with a 7 French if you want to trap and take the wire out.
If one dual lumen microcatheter to have on the shelf, it's probably Sasuke. I think it will be launched soon in India. I still have Crusade because it's twice cheaper. In most of the cases, it will be okay also. Don't forget about a very cheap technique called sidecar technique, where most of the indications for dual lumen catheter can be used. A dual lumen catheter is very useful parallel wiring if you're in subintimal space. On that topic, Rick Ross dual lumen microcatheter from Netherlands is unique because the second port, instead of one single port, it has two ports 180 degrees from each other. So it can be used instead of Stingray for ADR. That's why it's unique. Very important to have fine cross on the shelf. Why? I don't know how it in India, if you have 0.14 coils, we don't have much. We use still Tornado and Nestor coils, which are 0.18 for perforations. Fine cross is perfect for delivery, pushing just with any workhorse wire. I recently learned Caravelle can be used also for delivery of 0.18 coils, so these things are important to know, especially if you're in an emergency situation.
Thank you.